report where we continue
Right.
Good.
continue to report out on our data sharing activities. So my understanding is that the pilot project is really complete. It's reported out in that first progress report. And now ongoing are our 6-month progress reports where we continue to share updates on data sharing projects and our collaborative projects. So just wanted to sort of clarify. And then the trace biomonitoring study was the standalone project that gathered information from approximately 350 participants in different households across the state and collected a lot of valuable data on sort of the body burden of different contaminants with paired samples of their drinking water. But that was really a standalone project, funded by CDC from the National Biomonitoring Program.
Dr. Bush, wasn't there a follow-up study after that initial study though, or am I misremembering? I thought there was an expansion of that study.
Oh, well, I would say it was separate. So the first project from the biomonitoring program was a targeted arsenic and uranium study. That was the first project of the biomonitoring program. But I think of them as distinct still. The pilot project reported on here was really more of a demonstration project that, yes, the two agencies house data that are sort of managed separately, but we can come together and look at it in ways to address questions and noted significant limitations in both data sets. So I would still say distinct from the biomonitoring work.
Right. Oh, no, I thought there was a follow-up study after the trace biomonitoring or an extension of that study. No? That was it? It was just like a 500 group. That was it? The 500 people? Okay. Yeah, I think in any case, so because we have new members, it might be helpful to sort of run through both of those programs again, if you don't mind, in a future meeting. And then any limitations, like you mentioned, of the data would be good to refresh our minds again, especially since we have new people. One of the things that we embarked on as part of this commission last time, I think it started actually in 2019, was when the new administration took over, there had been a list of environmental exposures associated with known outcomes that NIH had put on their website, which is now, I don't know if it's back again, but it was gone for a while. And that's shown here on the left, a screenshot of it. And so what we decided to do was to work on a New Hampshire centered list of environmental exposures and outcomes. And so we did embark on that, and it's shown on the right here. It's a Google sheet that we continue to populate. I haven't been able to get enough attention to it myself, but I think as part of the data subcommittee and the education subcommittees, as we reform them moving forward, we should plan on contributing some information to that. I believe Senator Riccardi added some information to this as well. So as things proceed, yeah, thank you for that. I saw you put a lot of references into a separate tab as well. I think it's important to keep abreast of this and to continue to have this grow. I know DES had said they were doing something along these lines, and I don't know if they're continuing to do that or not, but in any case, I think it's good for us to continue to develop this list of exposures in New Hampshire and outcomes that are known in the scientific research. So as you can see, for example, here we have PFAS, which we know a lot of communities are exposed to. Here are some of the outcomes or the clinical markers, and then the outcomes here in this column on the right that are known to be science related, pretty much understood outcomes related to exposure. So I'd love to keep working on this and love to see that both of those subcommittees start contributing again to this list moving forward. This was one of the outcomes of the commission that was in a prior report. So this kind of gives you an idea of the kinds of things that we are thinking about here in the data subcommittee in particular, looking at how do we collect this information. The numbers in the parentheses relate to the charge of the commission. So under the first item, it's charge of the commission number 1. We're identifying relevant programs and looking at monitoring and surveillance broadly. How do we report that out, and how do we communicate that, and how do we build the capacity internally to improve those systems in New Hampshire? And then how do we engage with communities to do that? And there have been some apple tree grants and things like that that I'm sure Dr. Bush would like to comment on in the future. We're looking at engaging with communities, especially with respect to environmental exposures. So this is something we should, continue to look at and use as a reference for us moving forward in this commission also.
Just a quick point of clarification that the apple tree grant actually sits at DES.
Okay, sorry.
That's okay. Just.
I think Karen might have checked out, but oh, she's here.
No, she's here. I think
No,
she's here. She's just so.
Yeah.
So it's Karen could tell you more about it.
I was gonna say I'm still here, and I mean honestly, I think the fact that sometimes gets confused is sort of a testament to the fact that the two agencies work closely together, and we do work together on the apple tree grants. So
yeah. Any other comments or questions on this or any of the prior slides? Oh, Dr. Bush, were you speaking? Because you're on mute. Oh, okay. Great. So some of the past topics of meetings were, we had a presentation by a former professor from UNH who did a lot of work on arsenic and the cost of exposure to our children, which was very supportive and helped get HB 1592 passed a few years ago that reduced the exposure rate to arsenic in the state of New Hampshire through drinking water. So he presented to us, this is available on the website too. Things like other subjects were the biomonitoring trace program. We had a presentation on the birth defects registry, which I'm not sure what the current status of that is, but since, children are, sometimes the impacted by environmental exposures, we think that's a pretty important, birth defects registry is important to keep going. We've looked at lead in New Hampshire children from drinking water and from paint dust sources. We've had presentations on radon, which is another emerging, very big issue in the state of New Hampshire. Community health outlooks, and also synthetic populations, like I mentioned earlier, national environmental analysis and cancer cluster analysis. And I could go on forever. And if you guys want to chime in, any one of the legacy members wants to talk about something that I may have left off the list that's important. This wasn't meant to be an all-inclusive list, but just sort of a thumbnail to give everybody an idea of the kinds of things that we're doing. Representative Murphy.
Thanks, Vinny. I was just going to mention, since we're talking about past topics, right now there's a lead bill that actually was Chuck Grassie's bill that I put in. It was heard last week. We're going to be putting an amendment in, but we're working with DHHS. Hopefully, I think it sounds like there's a lot of support for that. And I'll just make sure that we email everybody to have everybody chime in and support that as well. When it goes to exec, which is Joe Shapiro is actually going to put an amendment in for me just to take in all of the feedback we got from daycares and licensing and the division. So I can keep everybody updated about that.
Yeah, so just to give a little background on that, SB 247 was passed into law, I believe, in 2018, which required blood level testing for 1 year old and 2 years old. Also had sort of an incremental reduction in exposure to lead through drinking water over the time frame. And then another bill came in last year that adjusted that rate down to that exposure level down to 5 parts per billion, I believe, for lead in drinking water. But what it didn't do was it didn't require any sort of check on whether or not children are actually being blood tested for lead. And we saw a big fall off in the compliance with that, of course, with the pandemic. That has sort of continued. So that bill that Representative Murphy is talking about requires, I believe if it's in the same form that I read it when I first read it, is adding it to the checklist of things that are required for kids to enter school. Is that correct, Representative Murphy?
It's correct that one lead level testing be on record. And the way the bill will be written, it will be sometime between like 9 months and 6 years of age. That there be multiple checks basically on that. The pushback came from daycare providers and after school programs who were found to be out of compliance when the parents didn't comply with that, and really the daycare providers had no control over not whether the children were tested. So we've come to an amendment that will will still increase the information the parents get. Will retain the requirement for kids to be tested unless there's a religious or whatever exemption. They can opt out, but that it raises the awareness again about the importance of checking for lead in children.
I see Representative Munns has your hand up.
Yeah, just a comment and then a question. So the Bob Woodward reference here was not the Bob Woodward, because I was thinking that this was a pretty significant group if they could get him to come and give a presentation. But
No,
on
Bob Woodward.
a more serious note, in terms of meeting topics, has there been any discussion about around the issue of privacy when it comes to collecting all this data? Is that a concern? Is that something that should be potentially looked at as we try to gather all this information on what's going on out in the public?
Actually, I mean, we haven't really specifically addressed that. We have had, people from, I think from EBC, it's EBI, I always get it wrong. EBI came and spoke with us about data collection, and the state has a dashboard that's, for community public facing. No, I don't think we have talked about that though in this commission.
I'm just anticipating that could become an issue, and rather than have it come up and then try to react to it, maybe just talk about it proactively.
I heard somebody.
Yeah, this is Karen. Sorry, it's hard without the camera, but I don't know if it's because of the wind or what. I'm just having some internet connectivity issues, but it is an interesting point that you bring up, and it is addressed sort of individually in some of the data sets that there are rules and statutes that sort of articulate or limit how certain data sets can be used and at what level they can be released, and what granularities in order to protect people's health information. So it is it is an important point that you bring up.
Yeah, I guess the thing I worry about is that we just if we can't get people comfortable that the data is going to be protected, or we've got some guidelines around that we end up losing, we end up having people not willing to participate, and then the data is only the quality of the information we get from the data is going to be diminished.
This is Katie. I would just jump in from the health department's perspective that we are a HIPAA compliant entity, which means that we have to follow the Health Insurance Portability and Accountability Act, and outlines really, like Karen's saying, how we can store and manage and then release any data that comes to us. So we get data from all kinds of sources, our hospitals, our providers.
Right.
And so that data is managed under HIPAA. And then that very clearly sort of outlines how we can then share that publicly, and it controls what data we can put public facing, what data we can use for internal purposes. So lead, for example, right, providers across the state are mandated to report childhood lead data to the state, and then we manage that following these statutes and governing, data governance policies as one example. So I think it depends on what data we're talking about, what sources of data, and what those data systems are. So definitely a lot of layers there. It's good to think about, and I think the implications are what can be shared sort of back publicly, such that privacy and confidentiality is maintained.
Yeah, I think the primary concern, the primary focus needs to be reassuring the public that the data, that the data is going to be protected and their privacy is going to be protected. But you know, that has come up as an issue in the past
Yeah.
in other areas.
We could entertain a presentation on that maybe in the future. That's a good idea. I put that on the list.
Okay.
Any other comments or questions or concerns or of the stuff we just talked about? All right, well, this commission has become sort of an adoption agency for some of the issues that have lost their home in other commissions. And one of them is education. Representative Murphy could probably speak to this a little bit more. There had been a bill that Representative Murphy sponsored looking to work on education issues with healthcare providers in the state of New Hampshire. And I think the former commission chair agreed to adopt this as one of the, if I'm not getting it right, I'm pretty sure this is how it happened. But so we have an education subcommittee in this commission now that looks to how do we work out educating the public and healthcare professionals and everyone else, even legislators, on all these issues. And Representative Salloway was the chair of that subcommittee formally, and Ms. DiTullio wanted to update us on her efforts today regarding that. There had been maybe Ms. DiTullio, you can update us on the last event that you all had and then talk about the upcoming activities you're planning.
Thanks, Mindy. Can you hear me okay?
Yep.
Okay, super. So last year we had our first attempt at reaching out to the provider community to do some education about specifically PFAS. And we did that through the Northern New England Nurse Practitioner Conference that was held in April at the Mount Washington. Now we got a late start last year. The conference was pretty well planned, but we did get a session on the last day in the last time slot, which is not ideal. And Dr. Patali and Representative Murphy presented from two different perspectives. So we were quite pleased in that, despite the fact that the room we were put in was like a sauna. I'm not sure if they were encouraging detoxification, but the door could not be left open to the room because it was right by the registration desk. This was at the Mount Washington in Bretton Woods. So if you left the door open, no one could hear. And so the door had to be closed. I was quite impressed with both Nancy and John. They did a remarkable job under less than ideal environmental circumstances. But we had an amazing, I think 25 people that stayed for the entire session and probably would have stayed longer. It gave us a really good sense of the need for information to providers. And so our second attempt this year is better organized. We actually have, so the conference is scheduled for April 14th back at the Mount Washington. However, we have a plenary session at lunchtime on Friday. So all of the attendees on that day will have access to, to the lecture, and it's estimated somewhere around 150 clinicians, plus or minus a few, attend during that on Friday. It tends to be a popular day. So this year, Dr. Patali is doing a return presentation on PFAS. The feedback was very good for both Nancy and John last year from the attendees. And this year we're having Dr. Megan Romano from Dartmouth Medical School. She's an epidemiologist, and she has presented with Dr. Patali a number of times. They complement each other well on what they cover, and she will be looking at more of the health effects from exposure to common contaminants. And then Nancy Murphy will be joining the group again, but more this time to inform the nurse practitioner community about legislation that might be important for them to get involved with. The NP community in New Hampshire has always been very, very involved in legislative issues. And I think we just need to give them the information, and then that will certainly turn out to be something good. So we're very excited about reaching more people this year. It's the Northern New England Nurse Practitioner Association conference. So it is going to have people, attendees from probably Vermont, Maine, and likely some from Massachusetts as well. So we'll hit a lot of people. Yeah, we're excited.
That's wonderful. Thank you
you.
so much for giving us that update. I think it's really important because, you know, the word gets around from nurses who are interfacing directly with patients, and it's really important to hear that that's happening. So thank you. Any questions or comments for Ms. DiTullio? Representative Murphy?
I just want to thank Peg for, this was a huge goal of ours for a long time. And as you said, I had submitted legislation and it was supported through the DHA, the Health and Human Services Committee, but they thought rather than make it a separate entity, that it should be sort of absorbed into one of the commissions. And that's how SB85, our environmentally triggered chronic illness commission, became the adoptive parents. But you know, often, you know, this, what precipitated this was just living in a impacted community. I would go to health providers, and many people, other citizens in this area, would go as well, and we would know far more about PFAS than the health providers that we were going to see. So it wasn't their fault; it just wasn't part of medical school. It was a you know, a new issue for so many people, and it's nice to see now when I go to an endocrinologist or something with one of my kids, everybody knows a little bit, and they didn't 2 years ago and 4 years ago. So it's efforts like Peg's that you know, get out to nurse practitioners across the state that can really make a difference in addressing these health issues and providing medical monitoring, especially in areas impacted, you know, as here, southern New Hampshire, the Seacoast. At least starting there just gives us, you know, some good solid footing, and you know, hopefully prevent some health impacts that just if we're able to get, you know, a handle on at the beginning. So thanks, Peg.
Has there been any outreach to the various hospital chains and maybe large medical practices?
Representative Murphy?
I know I had reached out to New Hampshire Medical Society when I was filing that bill before. Part of the concern at the beginning was that physicians didn't really want to be told what, you know, about a requirement for like CEUs, continuing education in this area. There was some discussion, and I know a real good advocate, Dr. Gary Woods, you know, was talking about maybe potentially doing it at a you know, a presentation at a medical society event, and you know, there was some outreach to hospital administrators to figure out how to do it, whether it's through like you know, lunch sessions, but you know, to date we don't have any of that in place. So the actual first steps were, you know, were Peg's for the New Hampshire, we see the Northern New England nurse practitioners, but absolutely something we should still be working on. I agree.
Do you think the hospitals and the major medical practices even know that the commission is doing this work? Okay.
Not likely, and I'm willing to look into that and help out. I need some assistance from some of the other members or another member, and then I can work through the hospital association.
Yeah,
Because my first thought was, you know, because in response to, doctors not being, liking to be told what to do, I can understand that. And maybe just start by, kind of a just innocent, just providing them with information that this even exists, and then, invite their input.
We also, so we have Dr. Timmons, who represents the New Hampshire Hospital Association. Yeah. And we have Dr. Kazal, who represents New Hampshire Med, who is on this commission as well. He's not often able to attend, but I do think that as we reformulate the education subcommittee, perhaps Dr. Timmons and Dr. Kazal can be involved in that with, other members that are interested, so that we can really sort of work off of the great work that PEG has done and others have done, and sort of replicate that to other medical professionals, other
Right.
organizations in the state. I think it's a great idea. It'd be great if we could do that. Looks like Karen has a hand up. Sorry.
Yeah, I was just gonna, oh, no, sorry, go ahead.
Anything else, Representative Munns? Did you want to, I didn't want to cut you off. Okay.
No?
I was just going to say this didn't really start out in my capacity as the environmental health program manager, but I ended up continuing communication in that vein. But at my own child's pediatric, just regular well child visit this year, I noticed on the intake form that they, it is part of the practice at Dartmouth to ask about water source, and we're on city water, so it, we wouldn't be someone who would follow up with testing of our water because we're not on a private well. But I did ask, what does Dartmouth do with that information? And our provider wasn't exactly sure what the recommendations were. So, I followed up to provide resources, and that provider was looking into sort of distributing those resources that provide information about water testing and treatment, and what resources are available to providers throughout Dartmouth. So I can follow up to see what's happening with that also.
I guess I had,
Good news.
sorry,
Go ahead.
I guess I had another idea too, another group that maybe is worth reaching out to, are town welfare offices.
What do you mean town
Maybe.
welfare? What is that?
I mean, maybe that's not the right office, but I mean, some towns or town cities have health offices.
Oh.
I mean, maybe just making them just aware that the commission is doing this work.
Mm.
That's all.
Mm-hmm.
But
I can speak to a couple of points quickly.
I should have quit while I was ahead.
I just want folks to know that in the health department, we do have a health officer program manager who coordinates all the health officers across the state and works closely with the Health Officer Association. And I know at least in the last year, they have run a training on water quality with all of the health officers. It's not specific to PFAS and it's not specific to this commission or HB 737 commission, but they did do a broad training on water quality and well water quality in particular, and testing and remediation of water quality. So certainly the health officers are our partner in all of this work at the local level. And then I would just say that our DHHS PFAS website does have resources for healthcare providers. We link out to our federal partner websites at ATSDR, guidance for clinicians. And certainly when this work really started back in 2015, 2016, there was very active engagement at that time with the Medical Association. We put out guidance for healthcare providers using our Health Alert Network and others. And we're in conversations currently at the agency of sort of how best to keep people continuously informed of some of this. So those, we are talking about how to make sure, and the work with PEG and others, I think it's a model that we could take to some of these other professional associations, these similar presentations. So definitely in agreement with needing to sort of replicate or duplicate these efforts where we've had great success with the Nurse Practitioner Association.
Good.
Any other comments or questions on any of this?
Yes, I would like to make a comment. Can you hear me?
Yes, is that Dr. LaPresto?
Yes, yes. Well, I think a simple solution to that is to be licensed in New Hampshire as a physician, you have to fulfill, a CME requirement. And just like you have to do, 2 CMEs of opioid education, you can have a requirement where you can do 1 CME, 1 hour of PFAS education on the adverse health impacts, for example. Also, recently, I had gone on the PEAS Restoration Board, and there is already a CME completed by a physician on this. I wanted to actually view it just to see what they talked about, but it's already completed. So at the local hospitals like at Exeter or Portsmouth, that is easily, you could present that CME that's already a 1 hour CME. So that's a very easy way to just either make it a requirement or present it at the meetings.
I just had a question really quick, Representative Murphy, for a second. Peg, there had been some discussion about that with the nurse practitioners. Was that ever implemented for that? Do they get credit for?
So this conference does give CME credits. It makes a huge difference. So there's no requirement in terms of environmental education, but there are CMEs for the conference.
Got it.
Mm-hmm.
I think Representative Murphy, you wanted to chime in. I think there was once that we talked about this.
I just wanted to say the bill I had written was the issue, that it would require CMEs regarding PFAS and environmental contaminants, and there was pushback against making anything requirement. So absolutely, I think that those interested in environmental health would probably be much more likely to seek it out themselves. And just over the last few years, there's a lot more available, in terms of CME's options. But I agree, it seems, people, if they're living in a community where this is happening, I'm sure that's just, that rises to the level that would maybe spark more interest.
And we talked in the last couple of years about the fact that Hampshire Medical Association resolution for the association, right, about PFAS and environmental exposure was one of the resolutions. I'll forward that on to people, but I'm not sure what's happened recently, but I know they did resolve that this was an issue that they were concerned about nationally.
Is Dr. Wood still on the commission?
I think, he was seated on this commission through his rep seat. I don't know if he still has some other position that he could be appointed through. I'm not sure, but it would be
That'd
good.
be great.
Yeah. We can check into that, though. I twisted his arm and tried to get him to come just for the heck of it, but he didn't come. All right, so anything else on this education? Thank you so much for all your work on this, Peg. It's amazing. And I really think that it could be replicated to other organizations and other, factions of healthcare. It's great.
I agree. It's a good model. It's a good model. Yeah. To just put in other settings for sure.
You guys, so will you be recording it, or will you have a slide deck or something from that you can share with us after?
I know that Dr. Patali made his slides available last year, and I'm pretty sure Dr. Romano would be willing to do that as well. The association is a little bit bare bones in terms of resources. So we had a long discussion last year about recording, and we really tried to figure out a way. It wouldn't have worked in that room, believe me. It was a lounge converted to a place where people, listen to a speaker. So it wasn't really conducive to that. We could talk about that again, and we meet periodically, and maybe there's something that we could do, but there's no formal recording of any of the sessions at the at this conference, unfortunately.
It'd be great if we could, you know, had the slide decks we could put on the website for this commission. If that's possible.
I certainly, we're meeting again in a couple weeks and I'll ask permission from them.
Great. Or, and maybe, you know, just like a paragraph summary of what it all was about and what it meant to put on the
Mhm.
website would be great.
Super, no problem.
Anything else on that before we move on? Okay, DHHS and DES agreed to give us an update both on the MOA. So back in 2018, I think the first iteration of this commission, we decided, Representative Pearson actually and I sponsored a bill that established a requirement for the two agencies to crosstalk with an MOA, a memorandum of understanding or agreement. And I believe that MOA went away and now they're still, I'm not sure. So I'm looking for an update on that, the HB 1356 MOA, and then also just letting us know when those progress reports will be coming in.
So I can speak to the MOU for the cross-agency data sharing, or it was a data sharing memorandum of agreement. We are working on updating that. It has lapsed, but not due to any sort of intentional lapse. It's more related to just capacity and everything on everyone's plate at the state. And so we are working on updating it. I will say that the lapse hasn't prevented us from continuing to be able to work together across agencies and to share data consistent with how we were under the memorandum of understanding. So no one should be concerned about that work not continuing. We are working on updating it, working together across agencies, and we're using a new template that the Department of Administrative Services put out. It's the terminology has changed to memorandum of understanding. It's our understanding based on communication with the AG's office that in real terms, there's no difference between an MOU and an MOA. What's really important is the content that's included within. And the updated MOU that we're working on will be consistent with what was previously agreed upon. And then as the need arises for various projects, we'll have project specific data use agreements, which will sort of clarify how data sets are used and, sort of a shared understanding of limitations and utility. And I don't know if Katie wants to weigh in as well.
I would just note that there is another bill moving through at this point, HB 391, that would sort of put this into statute again. So again, not preventing us in the meantime, in lieu of that, not preventing us from doing the work, collaborative work and any sharing of aggregated information that was already happening. So.
Do we have a timetable for that? We had talked about, I think we looked at like last August and that slipped by. Do we have a timetable?
I mean, I'm hesitant to put a date. It's in progress. I mean, it's under review with the legal team at this point, and it's really the Department of Administrative Services and the new template, and for all agencies to sort of understand that new process and template. So I think we're committed to getting it done as soon as we can. I don't know, Karen, if you have any other insights.
Yeah,
we're sort of working as quickly as we can across both agencies right now.
Yeah, it's been drafted, so it's sort of out of Katie's hands and my hands at the moment because it's in the review process. And, as needed based on the legal review that's happening, we'll make updates.
Does Representative Murphy or Representative Munns or Senator Riccardi, do you know who the sponsor of HB 391 is? I can look it up, but thought maybe you just know off the top of your head.
I don't know off the top of my head. There's so many bills.
It's me.
It's you, Nancy?
It's me.
You're a troublemaker. Yeah. That's great. Okay, so that I think would be another bill that I would like to, okay, so what I think we'll do is with the email following this commission meeting, I'll put out an email to the members with those two bills attached, 391 and whatever the number of the other one was that Representative Murphy has, that I'd like the commission to entertain support of next month when we meet and vote on. So I'll provide the background, or is that timing good enough, Representative Murphy? I don't know what the
Um,
we're getting close.
well, 6/14 will be going, that's the cancer, kidney cancer feasibility study. 6/14 will be going to finance probably this week or the week after. You know, and assuming that it makes it there, it'll be heading over to the Senate. And 391, I think that's a done deal. We're good on that. And what was the other one? I had a third one. I don't know, it's like slipped my mind all of a sudden. I
Okay.
don't know. I'll remember. I'm trying to email you, but 6/14 is the one that we really need. The oh, and the other one's a lead bill, the pediatric lead,
Yeah.
which
Okay.
is that 501 maybe? I can't remember the number.
All right. So we'll confer about the best way and timing, but it sounds like we can't wait till the next meeting. So what I might do then is send out the copies to the commission members and then send a survey poll out. And members can vote on whether or not they wish to support it. And so we'll look for that email. And if you could respond to that survey, either yes or no, that along with a proposed draft letter that I'll send for those three, if it makes sense. So Representative Murphy, if you would consider conferring with me on that, and we'll move forward on a plan.
Okay,
for those.
sure.
And then not sure, Dr. Bush or Karen, a progress report is coming in from the agencies. I can't remember when, did you say?
Yeah, so our last one was submitted in September, and we are working on updating that right now so that we can submit in March. My expectation is that we'll be able to have it by the end of March.
Okay. So possibly before this meeting will be about the same time frame. Do you think it'll be?
Yeah.
November?
We can aim for that. So, you know, as you can imagine, because it's describing collaborative efforts across the agencies, we need input from a lot of different people. So we've requested that people give us updates by March 10th, which should give us plenty of time to sort of review, finalize, and then send it through for approval. So we can aim to have it before the next meeting.
Okay, awesome. Great. And so any other comments or discussion on those matters? Those two? So the other commission that we adopted was the Coakley landfill subcommittee. There's a data subcommittee as well, and I apologize, we haven't been that active, but we should restart the data subcommittee as well. And if there's someone that would like to lead that, that's fine. Otherwise, I can continue to lead that effort moving forward. So the other one is the Coakley landfill. The Cancer Cluster Commission lapsed last year, and we adopted the Coakley landfill subcommittee to this commission. Representative Muse was involved with it, and I know Dr. LaPresto is interested in this issue, as well as I. So that's another subcommittee I'd like to reorganize and reestablish this session moving forward. So I'd like to, all of those I'd like to discuss at the next meeting. If there are people who wish to put their name in to lead those, especially the education subcommittee, and I'm not sure about the Coakley one, but definitely looking for new members to add to those subcommittees and sort of lead the charge in those areas. So would love to have some people volunteer to take those on. Representative Salloway is no longer with us on this commission, so the education subcommittee is in need of another leader. And if you'd like to take on the data or the Coakley one, please let us know via email. And then Representative Munns.
Is Representative Muse no longer part of the commission?
You know, he was an appointed member to lead the Coakley landfill, so I'm not
Okay.
sure I don't think he was formally appointed because he kind of was already on by the House. This time I haven't spoken with him lately. Maybe Representative Murphy has, but because they serve on the same committee. But I'll reach out to him and see if I can find out what's going on. Do you have interest in that?
Well, yeah, I mean, that just because that's, right next door.
Yeah,
That would be certainly
absolutely.
something that I'd be interested in helping with, and I can help with the data as well. I mean, wherever you need me the most.
Okay, great.
But
I'm assuming-
Coakley is definitely,
Yeah.
it's right near home.
Yep, I would welcome that. Dr. LaPresto, is that an interest of yours or just a general interest on this commission? I don't want to put you on the spot, so you can just let me know later, but I would like to have an answer for all three of these subcommittees at our next meeting, who's going to lead them and have a plan to go forward on them. So whoever wants to just chime in via email would be great. All right, topics for upcoming meetings. Like we kind of touched on, we do want to continue to try to get the DOE involved, just present to us, I should say, not involved, on the relative special education spending across the cities, across the towns in New Hampshire. Is anyone available, anyone on this commission has any connection to the DOE that could help us get them to come? Because I think we've made a few attempts, but not been successful.
I think I could probably get that done.
Yay. That would be wonderful. Okay, I'm going to put your name down and would love to have them come at their convenience, whatever you can work out. So what we're looking for from them is not anything other than just coming to present to us on relative costs associated with special needs spending across New Hampshire. Right.
Okay. Would you do me a favor and just send me a little follow-up email so with explicit things and the next couple meetings so I can give them some options so I can solidify it.
Yep, perfect.
That would be good. I can forward it that way and I'll also make a phone call. I'm pretty sure we can get that done.
Amazing. Awesome. Thank you so much. And Representative Murphy, if you have any comments on any other topics or other subject matter you want them to discuss, we can do that. You can let me know. Other topics, data privacy was brought up. I have that on the list. Representative Munns, any other comments, any other suggestions on subject matter presentations? Next, yes, Representative Riccardi. I mean, Senator Riccardi, sorry.
It's just Denise, it's good. Remember I did that presentation, Representative Salloway had asked me to do that. If there's a way to do anything further with that, I have many people who could present to us on many of these subjects around the country. Dr. Paul Haru from McGill University. If you want to look up Environmental Health Trust, Dr. Diva Davis has excellent books on these topics. I can get all of these people to zoom in and present to us on many of the topics at hand and also on what I had presented to you.
Great. That would be perfect. So we can, why don't you check with them? So we generally will meet, I think this time works fairly well for us, 3:30 on a Friday, about every month, about the same toward the end of the month like this. We have a little bit of play in that if we need to. So if you could check with them and let them know and see what their availability is, that would be great.
Okay.
And for both the DOE people and the other 5G people.
And they all worked together with Senator Sherman, the people that I'm referencing too.
Yeah, good.
Okay. All right. Thank you.
And then
You may,
go ahead.
no, it was me. You probably have done this, but I'm wondering if I guess the thing that occurs to me is, is there some kind of presentation on the prevalence of known carcinogens? Or, I guess carcinogens is the one that I'd be thinking of. The prevalence of known carcinogens just in in, kind of products that are part of normal life. I mean, just, do we have a good handle on that? Is there awareness of how prevalent some of these things are? It's not just that, we're talking about, PFAS in water.
Right.
It's much broader than that.
Yeah, I was surprised. I actually went to my dermatologist yesterday, and she mentioned that she no longer recommends people to use any sunscreens with any ingredients that are too long to pronounce. She thinks, because of the benzene that was found in a lot of sunscreen products now, she's only recommending people use natural or organic sunscreen products. So I agree with you. It's a big issue, not just in the water and things that we generally are aware of, but also everyday products. So if you have any suggestions on people, I'm not sure, melanoma rates in New Hampshire are pretty high. So that might be a dermatologist type of person, or somebody on that would be interesting, I think, for me anyway. And I agree. Do you have any suggestions of a type of?
No,
FDA or-
I don't, I'm sorry.
I'll think on that.
We could ask for a presentation from the Toxic Use Reduction Institute, Turi, out of UMass Lowell. They might be an appropriate partner to provide a presentation like that.
Do you have a name of somebody there?
No, but I could get one. One of my team members who's on staff now in the environmental health program worked there for years as a librarian. So, we definitely have contacts there and can work on trying to see if we can help line up a presentation.
That would be awesome.
And that's the kind of thing that would feed right into the education effort too, is, just trying to raise awareness about that stuff.
Yeah. Yeah, one of the things I've always tried to figure out how to do is get more people, because these are public meetings that we're having right now. And we almost never have any members of the public attend. Sometimes you do once in a while. But, having people attend these meetings that are open to the public is another way of, so looking at outward facing messaging on the website and things like that is a second, a backup, but we'd love to look at ways to get the messaging out from here more, not just educational to the providers, but also to the public, as you say.
Yep.
That's a great suggestion, though. Awesome.
It's unfortunate that, our standards are far lower than Europe. They don't allow a lot of these things on their shelves that we put on our skin, in our body, and eat. The standards are completely different.
Yeah. Very true.
And that's a great point. I mean, that could be an interesting that could be an interesting presentation, which is, okay, what is the EU doing on this topic?
Representative Murphy, who's that woman? Cost of inaction woman. I wonder if she would be a good person. I think Representative Murphy's not feeling well, so she may have checked out, but I'll think about that. I think that's a really good suggestion too. And if you have any ideas on that, that would be great. Other ideas. I love these ideas. This is great.
On getting more people to attend, maybe, on the PFA contamination, there's a lot of outcry for that and a lot of, involvement. Maybe we need to cross over to those people to get them more involved in this commission. I don't know, it's a thought, because everything's intertwined.
Yeah. Yep.
And on doctors' offices, pediatricians and things, I feel if we got the chiefs of police, AAA, the Nursing Association, some of these organizations, they're willing to help with funding for materials so that we could get the different practitioners informed and be able to have them pass information out to their patients. I was able to secure funds from them just for trying to do a bill that's giving information on why you shouldn't text and drive. Obviously, that's not related to this. And they were very willing, so the state would have incurred no cost. Unfortunately, the legislature didn't think that was important enough of the bill, and so they killed it. But I just think we sometimes, if we can come to the table with some funds from other places, it'll make the state step up a little bit and do their part.
Yeah. That's interesting that you say that, because so we had a water emergency in our town for 3 weeks plus, I think it was. And getting the message out to the public was a big challenge. And the police said they had an emergency. I can't remember what it's called. Maybe Dr. LaPresta remembers, but there's some effort on their part to have a call line or have a emergency hotline type thing or some sort of texting program.
Nixle, the alert Nixle, they use that Nixle alert.
I'd be interested in hearing about that too, because, that's a public health threat, and how you communicate that to the public is important. Dr. LaPresta, do you remember what that was?
I don't, but I know that there was a little resistance from the Rye Water District to implement that, because but they, what they did say in response to that request was that if you sign up for the alerts on our website, then you will get them immediately through your email. But they did not want to do a text system that the Rye Police has.
Okay, so in Bedford, you do have to sign up for Nixle. It's not automatic, but you get an alert on your phone for any sort of an emergency. And if it would be helpful, I can talk to my chief of police, Chief Brabonsky, because he is now the president of all the New Hampshire chiefs of police.
Did you say it's Nixle, Nixil?
I believe it's Nixel.
Yeah.
Nixle. And I get all kinds of alerts all the time, even if there's an accident. So I know not to go a different way.
Representative Munns, are you familiar with that? I don't, with Hampton's issue. No, you're not familiar.
No.
Huh. I'll look at my paperwork and see what, I remember the police chief gave it to me. But I would be interested in hearing about an emergency alert system for, look what happened in Ohio. It'd be great to know if we could notify a lot of people quickly if something like that happened here.
I wonder if the people from the state's emergency management agency would be able to shed some light on that.
That's a really good point. Yeah.
On what the capabilities are. Because
Yeah.
you don't want to, you don't want to necessarily do a statewide alert every time. It may just be local.
Yeah. Senator, were you going to say something?
Oh, the Department of Safety maybe has some answers.
Yeah. That's the emergency management people, right? DOS in Concord.
Department of Safety is the large department. Then there's a Homeland Security, Emergency Management.
Yeah, that's what I was thinking of, Homeland Security.
Okay.
And what is it called? New Hampshire Alerts, I think, is the app. I know we've promoted the use of that in some, community resilience building activities to be informed of, natural disasters. So, yeah. I am going to have to hop off too while I'm unmuted. I just want to say that. So,
okay, great.
I've got to transition to some childcare duties here late
Thanks
in the day. But
yeah,
great to see everybody.
Bye.
Thank you.
Any other suggestions for? These are great. This will keep us going for half a year on different topics to have.
I don't know if this is another topic, but it just occurred to me that I wonder if there's a way to engage with some of the media outlets in the state to just get them to be part of kind of the awareness raising that we're going through.
That's a great suggestion. You guys can probably hear my dog's trying to tell me it's time to go out, but That's a great suggestion. And just in the last week, I don't know if some of you saw the story on WMUR about radon in water and radon in air in New Hampshire. And as a result of some of that coverage, I mean, this is just anecdotal, but we did hear from our public health lab that there was an uptick in the number of requests that they received for water testing, and specifically to add radon onto the test. So it does seem like that's a way to sort of get the word out and encourage action.
Yeah. Yeah, I mean,
Yes, that was immediate in our town as well. In fact, I spoke with the superintendent of our district, and as soon as he heard that, he immediately called the analytical lab to get the radon part of our testing because it wasn't current. So yeah, that was fantastic.
And you know, I was thinking WMUR, but also, you know, the Union Leader, you know, some of the other newspaper chains, just to, you know, and maybe to invite them to be part of the discovery process that we're going through, in the hopes that, you know, as we learn things, that they will be in the forefront of making sure that people are aware of that.
Not every town has, you know, a broadcasting community. We have BCTV here. I'm actually on the board of BCTV, but we could use them for a public service announcement.
Right.
If you think it would be helpful, and then share it on your website.
Yeah. Yeah, some PSAs would be great. Yeah. There is there's an association of public access and government access channels around the state. And I haven't had any interaction with them. I learned of it, you know, years ago and never followed up. But there is an association, and that would be, you know, if we did have PSAs, that would be a way to funnel them out to the various communities.
Do you have a way to find out more info on that? I've never heard of that before, Chris.
I heard about it through the folks from the Exeter Public Channel. Let me see if I can dig up something on that. I don't even know what it's called, but I thought it existed. I'll do a little bit of research.
Okay.
I'm just curious, Mindy, what Senator Riccardi's her task regarding finding out about funding. What information? What are you trying to gather by obtaining that data about spending? Is it the more spending, then the higher number of diagnoses? What are you trying to obtain from the data about getting that funding for special education?
Oh, special education. Okay. Well, we've, you know, because there have been scientific peer-reviewed papers that show impacts to children from lead, you know, as you know, I'm sure, autism, special needs. We've heard a lot of anecdotal information about certain towns where there's high levels of exposure to PFAS, that there are children with a lot of special needs requirements. So we were just looking to see whether the DOE can provide us with relative comparisons across the state. And so eventually the idea would be to do something like they did with arsenic and water. So you overlay the extent of arsenic pollution wherever it is. You look for health effects, bladder cancer in particular, in those areas. You overlay those two sets of information. Then for PFAS, the same thing, and overlay educational spending, and just see if you can identify connections, or not necessarily causal connections, because we realize those are always difficult to make in this area, but, you know, looking at areas where there may be an association developing, where, you know, so we were just looking for, are there places in the state of New Hampshire that are more apt to be spending higher levels of money on special needs education, and do those coincide with areas that were known to be polluted?
Because the other thing you can do is just contact the Department of Education and see if they would give you information on the number of patients with or children with autism, for example, in that specific school district of those specific towns that were affected.
Yeah.
I
Yeah.
wonder if you could, if you can do that, if someone, you know, a senator or someone with a
Yeah.
important surname can get that.
That's kind of what we were hoping to gain from a presentation from DOE. Exactly. Yeah.
Mindy, can you still hear me?
Yes.
Oh, okay. I'm sorry. I kept putting my hand up, but I think that it
Oh.
wasn't working.
Sorry.
To that point, I think like Merrimack is a perfect example. The last couple of years ago, we were starting to see some increased special ed numbers for kids just entering their early intervention programs and preschool and kindergarten. And we're a community where, for example, my own children have now had children that are entering our public schools. They're all school age. So we're seeing, again, anecdotally, you know, just I look at my daughter's friends and the number of children of my children's age that have children now with autism. Yeah, again, you know, we're not saying anything's causal, but I've never known so many kids with autism among a group of friends that just happen to be the same age and grew up in this town. So it's all those kinds of things. And I think part of the problem with just getting the numbers from the Department of Education for specific diagnoses is that sometimes those diagnoses are not yet made. And maybe a developmental delay is not yet autism, you know, and, you know, they're, as often happens, you know, the kids are diagnosed with ADHD or until maybe a little bit later. So I know we were trying to get the DOE to come in and just to give us a sense of what they were saying. And, you know, although it's true, the specific numbers for certain codes would be helpful. I think there's also a group of kids that will sort of fall through the cracks, yeah, because they don't quite fit into those diagnoses.
One place where you might be able to get some information on some kids at an early age is through the area agency system with their early intervention programs. Because they're talking to kids that are from between the ages of 0 to 3, and particularly those that might have a developmental delay.
Can you repeat that, Representative Munns? What organization?
The area agency system provides early intervention services to kids from the age of birth through 3 years old. And you know, that is so you'd catch kids there that might have a developmental delay, and so you get some data that way. And then after that, it transfers to the school system.
Oh.
Yeah, I mean, Karen Carver's saying, you know, an example is Community Bridges. There's 10 area agencies around the state. Community Bridges covers Concord. They're all over the state.
War Center, Gateways in Nashua.
Right.
Yep. Yeah, there's a number of them.
Yep.
Right, Greta Goldsman. All right, I was missing I wasn't paying attention to these chats, but thank you. Yep.
And we, you know, and Karen and I both discovered that, you know, what I was talking about was the New Hampshire Coalition for Community Media. And we put the link in the chat. She beat me by a minute, I think.
This early area agency system, is it a network of across the state, or is it?
It's the vehicle by which the state delivers developmental disability services using Medicaid funding. So between the ages of 0 and 3, the state through Medicaid provides support, the funding for to help families that have concerns about the development of their children. And the state has basically outsourced the administration of that program to the area agency system. Yes, SISNY, those are the area agencies.
Excellent. Do you
And
know?
there's 10 of them around the state.
10 of them around the state. They don't data share though, would you say?
They do, not, each of them is independent. I mean, they're independent nonprofits.
Mhm.
There's some sharing of information that goes on. But they're independent nonprofit corporations that have a relationship with the Department of Health and Human Services.
So that would come under a Medicaid, did you say, spending?
Yeah. Yep.
So there must be a reporting mechanism on that then, right?
Yeah, oh yeah, there's reporting that gets done. What I don't know is, to the extent that they focus in on what the cause of the developmental delay is. I mean, they're more interested in helping address the effects of the delay.
Yeah, yeah. But no, yeah, so my thought was going on like, so if that's reported into a central reporting system, it would make sense if we had somebody to get.
The Bureau of Developmental Services within DHHS is the one that has responsibility for it.
Okay. Okay. Good to know. That would be a very, possibly a good topic also. Great. Well, any other final, there's another text, any other final suggestions or comments, or I really appreciate all this feedback. It's great. Gives us a lot of ideas of how to move forward with this commission. I think this is a very important commission, and I'm committed to making sure that we continue to do the work of this commission.
Right.
Thank you for all your work and organizing everything.
Dr. LaPresto, did you have something you wanted to say? Oh, you're on mute.
Unmute. Okay. Did anyone see the last HB 737 meeting?
Yes, I was there.
Oh, you were there. Okay. I was there too. Well, no, I was just, I reviewed it, but anyway, I was really heartfelt when I heard the social worker, I believe her name is Lori. She spoke about how there was, I was looking for my notes, but 7 pediatric brain cancers in the area, in her immediate area. And she listed the towns, like how many were in Milford, how many in Hollis, and she counted up to 7. And she said that they were on GoFundMe sites. So it wasn't a matter of privacy. And I just thought that the 7 over there and the 3 on the seacoast, although those were ages from 8 months to 4, and on the seacoast, they were an 8-year-old and 2 15-year-olds. And that's only what we know, what was presented. And I just thought that, is there a way to get information on how many pediatric cancers are being diagnosed? I know that there's the data suppression rule, but that's under less than 5. I just didn't think that, wanted to know if anyone thought that those numbers were concerning.
Yeah. So like I said in the beginning, this has always been a concern of mine, but the pediatric cancer cluster evaluation that was done by the state, I'm not sure if they're still here, or Karen's here, but Karen was involved, possibly. That was looked at least on the 510 area of the seacoast, and it was determined not to be elevated. But like you say, there have been several new diagnoses, not just brain cancer, but other soft tissue sarcomas and things like that. So that is a concern of mine, and I would like to query about pediatric cancer rates across the state, where they are, within HIPAA constraints where they're located, because I do think that's important to know. We only know what the rate is for the entire state. I don't have any insight into where those cases are, other than the two sarcoma, the people the kids that have sarcomas in the 5-town area, the Seacoast. But this has been a continuing concern of many of us. So,
Well, it's just that the brain cancer, there's no unknown hereditary component of pediatric brain cancer. And then on the Seacoast, there's, the thyroid osteosarcoma and the renal cell carcinoma were all, they were non-germline mutations as well. So, and that's just what we know.
that's just
not
recent
what we don't
too.
know.
That's just recent. There have been previous, for sure.
And the rhabdomyosarcoma and the PPB, there's a high correlation with, those are germline, many of the PPB at least, but there's also 30% that are non-germline. But I think that in the Seacoast Cancer Cluster investigation, those that were investigated were unfortunately were not unfortunate, but they were germline. Therefore, it was hard to make a, that's why the conclusion was made.
Yeah.
Anyway, just a thought.
That on the list. Good.
Thank you.
Senator-
Thank you.
Senator McCarty.
I tread cautiously with this statement, but with the work that I've done over the years, and I didn't realize that Representative Salloway, but he had done a lot of work as well. And when we have some of the presenters that I know, these doctors and toxologists and things, I'm not saying everything is related to this. We know we have the lead, we know we have the PFA contaminations, but a lot of this is the wireless radiation and the improper use of young people using their phones and things like that. I mean, the evidence is there, but you're dealing with, just like the tobacco industry, they knew for 4 decades that smoking was dangerous, but the money was way more important than coming out with the truth. And that is the same problem. Nobody should have that phone on their ear. It is causing brain cancers in people, specifically that type. And I try to educate people. We can't go back in time. I'm not against technology, but there's ways to do it safer and better. The industry's not interested in hearing that. And no one should be wearing it on their body. I mean, cancer in young people, anal cancer is up 35% from that phone being in their back pocket. And there are peer-reviewed studies over and over again, and all of that evidence is there. And again, I'm so happy that I can have somebody speak to all of us about it. And I think that a lot of the problems is overlap. Okay, how much can a person take? You live where your water's contaminated, right? And then you have wireless radiation also. I think it's a lot of those things. I try to tell young people I tell parents, when you let your children have a phone young, and they want to stream a movie, after they download the movie, they should watch it in airplane mode and reduce their radiation risk. So I know that's not what this commission is entirely about, but since we're talking about young people with brain cancer and tumors, I think it really warrants me mentioning that.
Thank you.
I noticed on the chart that was in the report, you've got lung disease listed as a condition, and you have COPD. I mean, is that the only kind of respiratory disease that, we need to be concerned about? Are there other respiratory ailments that could be caused by environmental factors?
COVID.
Oh, yeah.
Uh,
I'm thinking from, airborne pollution and, that type of thing.
Well, there's a lot of work on particulate matter and, asthma, for instance, and
Right,
climate
okay.
change. So that's actually a really good, actually, that's something I've been thinking about for a while. So,
And that's something where, we could have the air quality monitoring program from DES come in and possibly give a presentation about the monitoring that happens in the state. And, there's a community air monitoring program that was just established so that, DES can help support communities in doing their own monitoring and helping with validation of the data. So I'd be happy to follow up if that would be helpful.
that would be great. I would love that. Yeah. Okay, we're about at time, and they came in and told me that we have to leave by 5:30. So unless there's more, feel free to email if you come up with any other ideas. And for the people that offered to help identify some people and schedule some presentations, just let me know what you find out. And think about, taking on and being part of one of these subcommittees is super important. And then you'll also be hearing in the interim about any legislative support we might want to take on. Appreciate all your time.
One last thought, I will be happy to put in legislation next go round if it helps us with what we're doing. So that's a given.
Excellent. That would be wonderful.
We
I'm
do it
sure.
in the Senate and the House. That's even better. The same
Yeah.
bill crossing over.
Yep. Great.
Okay, thank
Okay.
you.
Thank you
Bye,
so much,
everybody.
everyone.
Thank you, Mindy. Bye,
Thank you. Looking
everybody.
forward to working with
Thank
you all.
you.
Thank you.
Bye-bye.
Thank you. Have a good
Bye-bye.
Bye,
weekend.
everyone.